And welcome to the International News Daily Podcast. I'm your host, Dennis Donicic. Now, before we begin our report today, I want to remind you to subscribe to our channel to stay in the loop on all of the important global affairs occurring today. Now, our main story today concerns Europe, and more specifically, coronavirus. Now, Europe is very quickly becoming the newest epicenter of coronavirus again. Now, coronavirus, as I've stated in last reports that we've done about the pandemic, has shifted epicenters. It changes from time to time. Sometimes the most infected regions of the world are in Asia. Other times they're in Europe. Other times they're in Africa. Other times it's the United States or North America in general or Latin America. The virus shifts in the tendency of how it affects people, and it goes in different waves. Now, the current and largest wave that is affecting the world is occurring in Europe right now. The last report we did on coronavirus was actually concerning this and the high rates of infections occurring in Eastern Europe. And these rates of infections were occurring because of very low vaccination rates, which were happening because people in Eastern Europe, countries like Russia, Ukraine, and other previously communist countries, have a genuine distrust of government officials because of rampant corruption, lying, and misinformation. So they were less likely to get vaccinated. And this still is a problem in these countries, and they are still having major infection and epidemiological issues. But what's interesting is the virus is now, and the epicenter has expanded to even Western Europe, which actually has high vaccination rates. Now, in fact, not a single country in Western Europe has a vaccination rate lower than 60%. Some countries, like Spain and Portugal, have vaccination rates that are as high or even higher than 80%. So these countries are vaccinated. These countries have mask mandates. And these countries have historically, since the pandemic began roughly 2 years ago, been viewed as the golden standard of how to respond to the virus. So what's happening now? Interestingly enough, these Western European countries are experiencing infection rates that are the highest since the beginning of the pandemic. These numbers are even higher than when the pandemic began and before we even had vaccines. So many people ask the first question: how is it possible for many countries to have the highest number of infections while also having the highest number of vaccinations? Logically, and what's been told to us by science, is that the more vaccinations we have, the less infections we will have. So what's going on? Now, the reality is that previously in the pandemic, before we had vaccines, we had much stricter lockdown measures in most countries. At the beginning of the pandemic, in most countries, definitely most Western countries, especially those in Europe after the virus emerged in Italy, those countries were under a complete lockdown. It was impossible to leave your home for anything that wasn't necessary, such as going to the grocery store, the hospital, receiving medical services, or being an individual whose work was deemed as essential, like a police officer, firefighter, medical individual, etc. At the beginning of the pandemic, lockdowns and restrictions were much stricter. There were no restaurants, there were no bars, there was no nightlife, there were no concert, there was no social life, essentially, outside of the digital world, of course. So the virus could not spread. Viruses spread between people, and if people stay at home, they can't spread the virus. This is logical. Now, while vaccines are increasing and vaccination rates are increasing all over Western Europe, the reality is vaccines are not 100% fully effective. Getting a vaccine does not guarantee that you're not going to have coronavirus. It also doesn't guarantee that you're not going to get very sick or that you're not going to die from coronavirus. And it especially doesn't guarantee that you're not going to transmit the disease to someone else. So why get vaccinated in the first place? The reason why is because vaccines significantly reduce the chances of infection, of spreading the virus, of getting sick from the virus, and of dying from the virus. Keep in mind, I am not advising anyone to not get vaccinated. I'm not spreading some anti-vaccination rhetoric here. Get fucking vaccinated is what I'm saying. But the reality is, it is not foolproof. It's not a perfect shield against corona, and it will not completely stop the pandemic. Now, how do these Western European countries now respond to coronavirus? What do they do? Some countries, like the Netherlands, have actually began to introduce another form of what they're calling a light lockdown. But that word light is bullshit. They are closing down bars, nightlifes, and restaurants. At least they're considering it. In Austria, the chancellor of the country has introduced measures in the two most infected regions of Austria where there is a complete lockdown on unvaccinated people. Unvaccinated people cannot leave their homes unless they're going for very essential reasons. Now, other countries, and Germany has considered recreating some form of lockdowns, but the reality is most Western European countries and most countries in the world today, outside of China, are going to be hesitant of introducing any kind of strict measures. Why? One, because in democratic countries, eventually governments have to have elections, and people don't like lockdowns. They do not like being shut down in their homes. I don't like being shut down in my home, and I am not an advocate of lockdowns. I would protest against that, to be completely honest with you. In addition to this, lockdowns create a lot of social problems. They destroy economies, they disrupt educational systems, and they create major mental health issues. And while we want to prevent and contain the virus, and the main reason for this is to prevent people from dying, economic issues, a lack of educational opportunities, and mental health issues also kill people. That's a reality. So a balance has to be made. These Western European countries most likely are not going to introduce lockdowns, except the Netherlands. The Dutch government seems pretty insistent on creating some form of light lockdown. So what happens now? Most Western countries have taken the same approach that Boris Johnson has taken, which is saying to live with the virus. The virus exists now, and we've had the pandemic going on for 2 years, which is a short time. But in that short time, we have developed a lot of tools to be able to contain it, control it, and understand what's going on more effectively. We did not have vaccines, effective tests, and treatments. There are now pills being tested and being opened into different markets that can treat coronavirus. So we can contain it and we can live with it, which was not possible at the beginning of the pandemic. But that is possible today. Now, finally, one other thing needs to be stated. While infection rates are increasing drastically in Western European countries, it is interesting to note that the rate of death is actually significantly lower. And the reason for this, a lot of the people being infected are actually vaccinated. Not the majority. The vast majority are unvaccinated individuals, and they are getting very sick, and a significant portion of them are dying. But vaccinated people also represent, in some cases, 25 to 30% of the number of infections, which is a lot. But their severity of coronavirus infection is much less than an unvaccinated person. They are not getting as sick, and they are not dying as often. And that is why the rate of death is much lower than it was before, despite the rate of infection being much higher than it was before. In fact, while Western Europe, if you look at it as a whole, has a higher infection rate right now in the past 4 weeks than the United States, and we're talking about per capita. So we're talking about per person. We're not talking about populations in general, numbers in general. Per capita has a much higher infection rate than the United States. However, the death rate per capita is much, much lower. The numbers are significantly lower than in the US. So the reality is some European countries are actually fundamentally and functionally being able to live with the virus. And lockdowns are being avoided because they cause a lot of other social issues. So the reality is, and many people ask, what do? We've tried lockdowns, they don't work. The virus still spread. We've tried mask mandates, they don't work. The virus still spread. We've tried vaccination rates, and in countries that even have 80% vaccination rates, the virus still spreads, higher than it has before. So what is the answer? The reality is that coronavirus is a very unique form of infection that is new to science and new to all of us. Its effects are dynamic, they're changing, and it's hard to understand exactly what is going on. And I'm not a scientist, so I'm not going to sit here and tell you what the solution is. But it seems to be that there is no one solid solution to ending the pandemic. There has to be a dynamic approach to a dynamic problem. Things such as general restrictions, not lockdowns, but relative restrictions to ensure safety measures and that people aren't in unventilated spaces and aren't too close to each other. Things such as general mask mandates. It's not hard to wear a mask. And making sure that the vast majority of people are vaccinated, not by force, but just making sure and encouraging them to get vaccinated are the way to finally contain and end this pandemic. There is no one solution. There are multiple solutions, but all of these solutions have to be utilized at once and in coherence with one another. Now, that's my opinion. That's what I think. Let me know what you think. Do you think that the increase of infected numbers shows that vaccines aren't working? Do you think we're heading into another major wave of the pandemic? Do you think this pandemic will ever end? What do you think is the future of coronavirus? Let me know in the comment sections. Like this video. Let's have a discussion. I'll see you next time. Thanks for tuning in.